Well, hello, Springford, and happy Wednesday. It is great to be here with you today. I know we were off last week. We didn't have a video, but we did reach out to Montgomery County Office of Public Health, and we're very excited to welcome Michel Masters with us to be with us on this weekly video. So, Michel, thank you for being on. It's good to have you here. Our format's going to look a little bit different today. We're going to just, we're going to turn it over to Aaron, and Aaron's going to we're going to have a conversation that Aaron's going to kind of drive. We did get some questions submitted to us from some parents, might be some clarifications that we can provide as well. So we're happy to kind of have this conversation and share that out with our family and our community. So Aaron, let me turn it over to you and we'll go ahead and kick this thing off.
Great, thank you. So last week in Weekly Update, we put in a form where our families could submit questions to the Montgomery County Office of Public Health. We've pulled everything together and we're going to have a little conversation with Michel. Can you tell us first a little bit about yourself, what you do for the county, and maybe what the last 2 years have been like for you?
Sure. So yes, my name is Michel Masters. I am the Division Director for Communicable Disease and Control at Montgomery County Office of Public Health. How to summarize the last 2 years is kind of where you all are at. It's been an intense last 2 years. I remember we were told this was only going to be a 2-week experience back in March 2020. And here we are almost 3 years later, still dealing with COVID, but not only COVID, from the Office of Public Health, we also deal with other infectious diseases like measles, mumps, pertussis, hepatitis. And we're seeing all of those start to emerge as well as COVID starts to decrease. So we do a little bit of everything in communicable, and we try to help support public health in general in Montgomery County.
Can we just go right into our questions? Can we dive right into it? So
Absolutely.
Let's start off with talking about masking. Here at Springford, we are still masking. We're masking when in high, and we've been in high for a while. We have that listed on our dashboard, and we include our level transmission and weekly updates. So what is the Office of Public Health recommendation for masking in schools when we move down into substantial, which fingers crossed, I feel like our numbers are going down. So I feel like we'll get there soon.
Yeah, I mean, that's a good question. When will we get there? So we always say our crystal ball or magic 8 ball. I don't know when we're going to get there. Numbers are decreasing fairly quickly. I think what we've seen with the Omicron variant is a very big surge, a lot of exposures, a lot of cases. And since everyone really has been exposed at this point, or we believe to be exposed, the cases are going to drop. So we're hoping March, we start to see possibility of being in substantial. We're talking about masking. The question is, what is masking recommendations? What do we recommend as a county for masking? And our masking recommendations are based off of community levels of transmission. So we know we're in high, or what I like to call high right now with the number of cases. But as cases start to decrease, the risk of somebody being exposed or possibly getting infected decreases. So that's where our masking recommendations change on the susceptibility of getting infected. So when we're in high, or high as I described it, we do recommend universal masking. So no matter what your vaccination status, indoors or outdoors, we do encourage masking. For substantial, we want masking while indoors. For outdoors, we only recommend masking as an optional preventative measure, but if you are around individuals that are outside your household, we would ask you to continue to mask. In moderate, that is where we start to move to optional masking. We do try to encourage masking of those that are unvaccinated, and that's the same in outdoors. If you're fully vaccinated, masking is optional. If you're unvaccinated, we would encourage you to consider who you're around outside of your household. And then when we're in the coveted low, where we were last summer, where cases were really low, it really is up to an individual. It's optional masking policies, indoors and outdoors.
So, Mr. Rizzo, we're, as we just said, in high right now, so we're mask required. According to our most recent update to the health and safety plan, which was approved in January, that changes a little bit for substantial. So one of the questions that we've received from parents is how Springford and Office of Public Health sort of balance in what we're doing and what OPH would like to see with substantial.
Sure. So whenever we approved our health and safety plan in January, we had it approved that we would be mandatory masking if in high and recommended masking when low, moderate, and substantial. It was the next day that we received the official guidance from Montgomery County Office of Public Health, where they were saying both substantial and high. We kind of knew they kind of felt that way, but it wasn't really official. So I did reach out to Michelle pretty quickly, and I just said, we just approved high. What does that mean in terms of the things that are going to be put in place, like masks to stay, and some of those gradual strategies that we're kind of shifting around as we learn more and more about the virus, and we are, able to back away a little bit. And I gave her an assurance that once we started getting close to being insubstantial, that we would revisit the health and safety plan if we still needed to have that language in place. So I believe that at least for right now, Michelle felt comfortable, given where we are right now, that we can still take advantage of those things that Montgomery County is offering us. We're not going to lose that because we're insubstantial, it's recommended, but that we're going to revisit it in February if we need to.
Right. And I think it's very important what you said, revisit. So everything, all these recommendations are really a living document as we start to learn and develop more about our understanding with COVID and what variant we're dealing with. So, the recommendations about masking and mitigation steps that we say now is always subject to change as the data and the science comes out and changes from CDC, from our scientists and other governing agencies.
And you mentioned when information comes out and changes, we see changing happening a lot. It almost feels like a decision is made, and then a few days later, from anybody, any organization, that information changes. And why do you think, is that because we're seeing such a change in the variants themselves? Is it because we're in a different place than we were when this all first started? How do these changes come about?
Yeah, so it's a little bit of everything. So it's what we learn about the variant. It's the population's ability to do these mitigation strategies and the layer of mitigation strategies. And it's the data coming into CDC and other agencies. And I think we've experienced in the last 4 or 5 weeks such a quick change to a lot of things, and being able to digest that and implement it has been very difficult. And I suspect that we'll continue to see that, but it's based on what the science says and what we know is happening in the community. But we do understand the challenges, and we have the challenges too as public health. We take guidance from CDC and we have to interpret that for best for Montgomery County. But we do try to move as quickly as possible, knowing that some of these things are beneficial to our families and Spring Ford families.
Just to follow up on that a little bit, we talk about the holiday break, back in whatever that Monday was, right after Christmas, the 27th or something like that, where the CDC guidance came out. And I think, it wasn't only Spring Ford that got a little bit of whiplash. I'm pretty sure Montgomery County felt a little bit of whiplash as well, because it felt like a stark change from what we were doing. And then we all had to kind of work through what that actually meant. And we did have a meeting that Thursday, I think it was December 30th. But that was a regularly scheduled meeting that we have weekly with Michelle, with Dr. Arkush, and just, and the superintendents of Montgomery County, just to kind of track numbers, talk about what we're doing, ask questions, that kind of thing. So we did have a chance to kind of digest a little bit what CDC put out. And over the next several weeks, we saw, I think, 3 or 4 updates from Montgomery County. There really was a response to CDC, the data, our local data has been changing as quickly as it has been.
As we're talking about changing, one of the questions that came in was, when will the county ease up on masking, contact tracing, and quarantine guidance? And I feel like as we look back on the past 2 years, we have eased up and changed a little bit. So would you say that would continue, your guidance from the county continue to change as we see numbers change throughout the county?
Yeah, I think it's an evolution and a transition. Masking, contact tracing, quarantine, isolation, those are some core components of public health that we've done forever in public health and public health investigation. I think at this time, we're at a unique time. We're transitioning as vaccine becomes more widely available, as we learn more about COVID. Will be continuing to be changes. When that happens, I don't know. This is a time we're discussing at the county, state, and CDC level of what is best used for prevention strategies. We know our public health agencies are pushing to transition away from contact tracing and case investigations, but there is still a need for that higher level functions when we talk about outbreaks and outbreak management. We don't want anyone to get sick. We don't want anyone to be hospitalized or die. So there's still some measures that need to happen right now to prevent that in the community.
And we have, Erin, and we have lessened in terms of what our requirements are for contact tracing and contact tracing, right? We were contact tracing in all areas. And with universal masking in place, we did reduce contact tracing in all areas, really to those higher risk areas. And at which point that we would consider cafeteria with no masks off, one area that we're continuing to contact trace as recommended by Office of Public Health, as well as higher risk activities like we're talking about band and chorus and in athletics, those types of things. Whenever there's high levels of exhalation, if that's the right word, higher levels of exhalation without masks on. So we have reduced the amount of contact tracing we're doing. We're not doing it on buses now, and that includes seatmates. We stopped because, again, that universal masking piece is in place.
Well, that is a perfect transition into our next topic. I do have one more question about masking. I'll circle back to it because that was such a nice transition. I don't want to ruin the mood of the layout of the episode. So let's go into contact tracing. So the next question that we have is, why did Spring-Ford stop parent notification of exposure or contact tracing on the school bus? And why did Spring-Ford discontinue contact tracing in the classroom? I don't know who wants to touch on this one. We did just talk about stopping that, but does the county support that as well?
Yeah, I could start. So that, at the county level, we did prompt prioritizing contact tracing. We know that the disease burden is very high. We know that contact tracing is a tool to identify those that are exposed and to put them into quarantine. But we also know that Spring-Ford and a lot of our other school districts have multiple layers of prevention, which we kind of talked about. That's vaccination, that's masking, that's contact tracing, quarantine, and isolation. That's hand hygiene and cough etiquette. So we know that's happening in a lot of our settings. So Montgomery County really wanted to focus our public health efforts and resources, and the same as the school resources, on areas of high risk where some of those mitigation layers have been removed. So that's where we've removed the requirement for contact tracing in the classroom, as well as on the bus, because those measures are met. So we have distancing, we have masking, we have airflow and ventilation that are all happening. The focus on those high risk activities, and maybe Bob will go into this, where we say contact trace in sporting activities where there's increased respiratory droplets, or in the cafeteria, you can see that some of those mitigation layers are peeled back. The masking, the increase of those droplets. So we want to shift a focus to where that most high risk is to preserve our resources and where we most likely will see the most risk of in-school transmission.
Yeah, and just to follow up, when we talk about our classrooms and not sending out those notifications early on back, November-ish 2020, whenever we were still really in the knee deep of the original version of COVID. We were 6 feet apart in all environments, and there was a lot of very intense things in place that we at that point we needed based on where things were, and we talked about that Swiss cheese layer, right? So in all of our classrooms right now, we're 3 feet apart, so we are in that that close contact exemption for students, so they're 3 feet apart with the mandatory masking in place. Our teachers are doing everything they can to make sure they're staying 6 feet apart. So we're really, those layers in place, our classrooms are really safe. And as we look at our own data, we're really not seeing, many instances of what we refer to as an outbreak, or what we were talking earlier about, any kind of in-school transmission from student to student or staff to student.
And when we're talking about masking, contact tracing, and cafeteria, let's go right into cafeteria and lunch questions. When we move to mask recommended in substantial, when we Spring-Ford, if at that point, that's what our health and safety plan still says, what will the recommendation be from the county regarding lunch and classroom while we're in substantial?
So I can talk about what our current recommendation is. I can't tell you when we're in substantial what the data is going to look like or what it's going to look like because it may change. But right now we do recommend. Let's talk about the cafeteria. We do recommend 6 feet when feasible. We know that's not possible. Our goal at the Office of Public Health, and we've worked with our school districts. We know the importance of being in school and providing in-school education to the whole person, to the whole student, and to the community. But we also know that there might be individuals that come back that might be infectious, and there's a risk for exposure, but it's a risk-benefit analysis. So we feel like what has been discussed before, we've not seen that much link transmission in the cafeteria. So we know that even though 6 feet might not be feasible, it's also best for the student to be back in person. So, essentially we want to support schools having in-person education. And we know if feasible, now it's not feasible in all schools, but we want to make sure that we're able to continue to allow students to come in person. We know there can be some barriers if we require 6 feet in the cafeteria. That's having separate classrooms for individuals that might be under quarantine that come in. That could be staffing, that could be separate meal times. So we do really encourage schools to assess if they can and can't. And if they can't, we still think it's important for students to be in person.
Here at Springford, when our students come back off of that quarantine time period, they're back into the classroom in the cafeteria. One parent asked why students aren't separated or they don't eat in separate areas in those final days of what they're calling the contagious period. And that could be for, I guess, either one of you to answer.
I could talk a little bit about, so we do follow CDC guidance. So when CDC updated their isolation and quarantine guidance at the end of December, they did provide some information about Omicron and when people are most likely to transmit the infection. That's could be 1 to 2 days prior to having symptoms, and an average about 2 to 3 days after. So using that guidance, it is thought that individuals who come back from isolation or quarantine after day 5 are less likely to transmit. And I think it's important to be able to implement as much mitigation as possible, but when feasible. So 6 feet may not be feasible, but we do know there's a decreased risk of transmission during that time period.
So where we are at Springford is, we make decisions as a team. We talk as a team and we get all the building principals together to talk about, again, what's feasible, what's ideal, what's practical. And the 2 main barriers that we work through, one is actual space. Our cafeterias, because we're in many cases spread out as far as we can, creating separate eating areas isn't always feasible in all of our buildings. And the other thing is we're also making sure that we have appropriate staff. We have to be able to staff the buildings, or staff, monitor the students if they're in a situation like that. And the last thing that really I think our principals grabbed onto was just if a student is identified as a close contact, and we don't want any stigmas attached to them because they were near somebody who might at one point have been infectious. We just want to make sure that we're respecting the student and we're respecting what their needs are when they're in the buildings as well. So we have those conversations. If we were to create more space by losing our gymnasiums, for example, then that has an impact on the curricular programming as well. And that wasn't something we were really ready to sacrifice, knowing that looking at our data, which we look at pretty regularly, we're not seeing that in-school transmission. We're not seeing those outbreaks happening on a regular basis. We generally feel like our buildings are pretty safe.
Yeah, so and to support that, just to support that, in the Office of Public Health, when we provide our recommendations, part of our thought process is what is feasible, what can actually happen. Because part of the prevention of COVID is if there's unrealistic mitigation steps that can't happen, then there's no point in providing those recommendations. So we really have open conversations with Springford and our other schools to be able to provide guidance that is feasible, that can be done, to still allow that in-person education, which I think is very important. So it's not just a statement out there without thinking about the impact to the community, the day-to-day for students and staff when they're in school.
Let's talk about, we've mentioned a few times, transmission and where it's happening. And this might be, a bit of a hard conversation to have outside of the school community. We've not seen a large number or a large amount of in-school transmission in Springford, but we do see large numbers in our footprint. So what does that mean in terms of transmission? Where is the county seeing most of the transmission happen?
I think right now that's really difficult to say. So with these levels being of high community transmission, we really don't know. We know that during the colder months, individuals gather inside. We also know surrounding the holiday season, families get together, friends get together. So we assume that's actually where some of the surge has come from. But at this point, with this level of cases, we aren't able to continue to contact trace every single case of COVID. We do our own prioritization at the county level. So we really can't tell you exactly where this is happening, but we do suspect that the spikes are coming from those indoor gatherings. So I think I pretty much summarized it, but what we're saying is that transmission, we don't know where transmission is happening because the community level of transmission is so high. We do attribute these cases being associated with more indoor gatherings as the weather gets cold. And that's typical with other respiratory illnesses like influenza. We see an increase in winter months. And then the gathering habits around the holidays where you get together with family and friends. You're not necessarily having that distancing. You're not having that masking, which is also what we're attributing to these increased cases in the community.
You know, and in those few instances where we did have some in-school transmission, I get a phone call from Michelle and this is not the fun phone call. Just want to give you some updates on this is where we are. We're tracking it. And then we get some recommendations, whether or not we need to shut down. Early on, we were closing buildings as we learn more about COVID, as we learn more about the best strategies. We took a more strategic approach. We might talk about closing a classroom or doing some other things to keep kids in school and to keep our buildings open as much as possible. But again, we haven't really had many of those conversations because things have been really pretty good in our buildings.
Yeah, and I feel like us as a county is in a different place with our schools. We know how important it is for kids to be in school, to learn, to be around others. So we really are trying to make every attempt to not have to move anyone virtual or to cancel any activities because we know how important that is. If contact tracing can happen, if we can remove those people that are susceptible, then there really is no need for a move virtual. But contact tracing is time consuming. We talk about only doing in specific areas, but that does take a lot of time. So sometimes we just need time and the schools need time to be able to contact trace and get all that information together.
One of the questions that I'm going to circle back to is why are we still masking when we're not under an emergency order anymore? And I think this is probably really specific to Springford because we see different things happening in different districts. So let's just talk about what's happening here at Springford.
So again, while we're not under an emergency order at this point, we do follow what we're told to do by Montgomery County Office of Public Health, and they pretty much clearly identified in their health code the strategies that they can implement, that they can employ, or they can tell us that we need to employ. Michelle, I might want to defer to you at this point to talk a little more deeply about that. But again, we are fortunate in Montgomery County to have a health department that supports Montgomery County. That's not the case throughout the Commonwealth. So Michelle, I'll probably turn it over to you now.
Yeah, so our health code does allow us as a local health department to identify disease control measures or mitigation strategies of what it's been called with COVID to protect our community, to protect our students, our schools. We know masking is one of the multiple layers of prevention, but masking is really useful as what we call source control. So for individuals who are developing COVID, who are either asymptomatic, so they don't have symptoms, or before they even start to have symptoms, to prevent the transmission of the infection. But we also know masks can be used to prevent an individual from getting infected. So right now, we know universal masking really does significantly reduce virus in the community, and that's why we recommend it. Specifically, you'll see it as I covered, our guidance recommends it when it is substantial or high. So when the risk of transmission to COVID to others is high, that's where we really want to support universal masking because it does help reduce that community level.
And as we're talking about mitigation levels, let's talk a little bit about vaccines, if we can. We had one question from a parent saying that they're asking if natural antibodies, I'm assuming they don't say it in here, but if the antibodies that one would receive after having had COVID, or is the Office of Public Health recognizing those natural antibodies as being equivalent to or in line with being vaccinated?
Yes, that's a great question because there's been a lot of confusion about that. So currently we follow CDC guidance related to antibodies and accepting it for a source of immunity. Right now, again, I say that we're only about 3 years into developing our information and knowledge about COVID. So right now we know that antibodies from a vaccine or from an infection, specifically from an infection, can decrease or wane over time, but we don't know how long it takes for that waning. And we also don't know what the threshold of protection is. So essentially the threshold of protection is the level of antibodies you have that protects you from getting COVID. We don't know when that wanes or how long it wanes from somebody who has an infection. So until we gather further data, we can't use antibodies as a sign of essentially that you are protected from COVID like we can with vaccination. So until more data comes out, until there's more research, we can't support using antibodies as a source of immunity, especially for those that may have been exposed.
So my last question, probably for the two of you, is how often do you guys talk? We've heard you mention a few times being in touch and talking weekly and probably almost daily, but how often are you two in touch? Being Bob and Michelle, not the school district and the county, but actual human face-to-face, text-to-text interaction.
Yeah. Well, I make it as a priority for myself and my staff to be available 24/7 to our school districts. And I think, Bob and I talk, yes, probably on a daily basis. We talk very frequently, and I think it's important. And I think it's a benefit of having a local health department that we are available 24/7. I think as questions come up, as we're learning, the health department needs to be able to respond to our school community. So we talk frequently. I don't know, Bob, if you want to talk about more than that, but it's definitely anytime he needs me, he's able to call or text me. And I definitely make an effort to make sure I respond to any time he reaches out.
So I will say this, that Michelle, I'm not quite sure how she does it. We have 21 school districts in Montgomery County, and if she gives them the same level of service as she gives us here at Springford, she must not have a whole lot of time for other things. Anytime I have a question, I can call or text. I know I'm going to get a response pretty quickly. We do meet regularly. We do meet every week with the Montgomery County superintendents and the Office of Public Health. Oftentimes, Dr. Rubin from CHOP, as well as Dr. Arkush, one of our county commissioners. They're on that call weekly, so we can stay in touch with each other. And I will say this: when it comes to Montgomery County, there's a whole lot of collaboration that has been happening throughout the whole pandemic that has been really helpful to me as essentially a new superintendent trying to navigate these waters.
Yeah, and I would echo that. We, Montgomery County Office of Public Health, it's not a vacuum. We can't do it on our own. We have to get buy-in from our community, our partners, and that's what Springford is, our public health partners. And we need to hear from you all. We need to understand what the questions and concerns about, and we need to take that back and use that information to make informed decisions, as well as look at the science. So this relationship with Springford and Bob is extremely important to move us forward through COVID, and has continued to be able to support the changes that we've made as a county.
Michelle, thank you so much for coming on, for joining us today, for answering a few of our parent questions. I think this was really helpful and a great source of information for our parents as we're now into this new stage of COVID and COVID-19 and how things are changing. And now we understand, I think, a little bit more why our schools and our process looks the way it does right now.
Well, thank you to you all, as well as the Springford community, for having me. This was a great time and adventure to learn about everyone's comments and concerns, and be able to really advocate for us as the public health, as well as the families in your community, to be able to give direct information to you.
Thank you, Michelle. I appreciate it. We really enjoy these weekly updates. It's a kind of an informal way to provide information. So we do appreciate your comments and being accessible.
And Bob, I'm going to have you stay on so we can talk about HVAC.
Sounds good.
Thanks, Michelle.
Thanks, Michelle. Take care.
Thanks, everyone.
See ya.
Bob, you spoke with another Bob Hunter. We have many Bobs in the school district. Bob Hunter and Bob Rizzo had a Bob sit around. And you guys talked about HVAC here at Springford and really in the cafeteria and the classroom areas. So let's go into one of the questions we had from our parents about portable air filters in the cafeteria. Would that help with transmission? Meaning what they wrote, meaning more than what the HVAC system does.
Yeah, I mean, that's a great question. And again, I'm relaying what was relayed to me. I am not an expert in that area. but I do know that Bob Hunter was and is very, very invested in making sure that our students were safe as possible. So there were definitely discussions with their consulting engineers related to the portable air filters and cafeterias and how effective they would be over such a large area. One factor they considered was the low in-school transmission rate based on the functionality of our current HVAC equipment as it's currently operating. Their focus was really on making sure that our systems were optimally functioning instead of bringing in other types of filtration that may or may not have an impact. So Bob really worked with the engineers. They had some conversations to determine our process was the best process to move forward.
The next question, should we have portable air filters in the classroom, especially when we move into mask recommended?
So once again, it's actually, the answer is really very similar. Early in the pandemic, the district did investigate the effectiveness of using portable air filters in the classroom. This was vetted through our consulting mechanical engineer. And I guess the end result was that the focus really should continue to be on maintaining proper operations of our HVAC systems in the classrooms. And at this point, Bob is really happy to report that all of our systems are operating as designed and at a full capacity of 100%.
We've seen some other school districts who have moved in that direction. It seems though, it might be more because their HVAC systems weren't quite on par with where ours are now. Would that be accurate?
That's probably fair. And like, as you know, whenever we started talking about opening up school, we started getting a lot of information from a lot of vendors, and it didn't take long for portable filtration systems to grab our attention, to grab everybody's attention that this might be the next best way. And when Bob was having those discussions, it came to, was there any real actionable data to support how effective it is worth the expense, and how that's going to work in tandem with our existing systems, which we believe are really top-notch systems, as Bob reached out to outsiders to come and give us a comprehensive review of what our capabilities are.
Our final question, what is the percent of outside air that buildings should use to maximize the ventilation system's ability to clear the virus? And is Springford using that percent?
That's a really good question. And again, I had to rely on my friend Bob. Early on, pre-COVID, the outside air dampers in the classroom HVAC equipment was set at, they were set at 8%. Open, which is per the design specs to meet ASHRAE standards, ASHRAE standards. And that provides 15 CFMs per student. Don't know what CFMs means, but Bob said that's a good thing, right? So, and what we noticed early in our school year was our buildings were much more humid than normal. And that was because the next part of this is when COVID hit, we opened up our outside air dampers for classrooms to be at 15%, twice as much, to increase the outside air coming into the classroom, which allowed a little more humidity to come in, made it a little bit more warm. But again, that outside air was really important. So we went from 8%, which is the standard, and we increased that to 15%, which Bob said really has made a difference in terms of clearing things out.
And just because I was curious, I did look up CFM means cubic feet per minute.
Well, there we go. It makes sense.
I think this was really great information that we're able to share. I will let you close this out because this is your show.
Well, first, I want to say thank you once again to Michelle, even though she's gone. We appreciate her coming on. And Aaron, it's always nice to have you on to help facilitate and have a good conversation. So we really appreciate that. As far as the Springford community, thanks so much for tuning in. If you like what you saw, share it. We want people to know what's going on. We want people to know who Michelle is and how we make the decisions that we make. So thanks again, Springford. We really appreciate you. Have a great week, and we'll see you next week. Thanks.